I represent Buffalo, New York, Niagara Falls, the Buffalo-Niagara region. We know that the Buffalo VA hospital has recently had a removal of their leadership. The head of the hospital and the chief of staff have been removed, put in now interim leadership there because of really outrageous actions that are alleged and a lack of care for some veterans. Dr. Ellen Hall, first of all, thank you for taking the time with me this past weekend to discuss what's happening over there and your commitment to rectifying the situation. I know right now there's an investigation that's ongoing. Inspector General, Ms. Hill, can you just give a timeline on when you expect that to be completed?
Our investigation has been completed, as is our practice. We provided VHA with a draft of the report, which includes the recommendations, and we're waiting to hear back from VHA on their responses to the recommendations.
And so the completion of the investigation and the follow-up will be, what do you expect on that?
As soon as we get it back from VHA, which should be relatively soon, then we'll be able to turn it around and publish the report and then provide whatever briefings to you and your staff.
Thank you. Dr. Ellen Hall, just again, thanks for your leadership. You know, we toured the VA hospital with members of this committee, staff members. You're committed to coming to Buffalo to visit the VA and see firsthand. There's a real crisis of confidence in the hospital system right now based upon the removal of the leadership and the stories that we've heard, a lack of staffing appropriately, what's been deemed as a hiring freeze. From what we've found out is it's a real hiring delay of 9 months, effectively a hiring freeze. We discussed the finances that should be included in the CR in order to not only rectify Buffalo, because I think Buffalo is a real demonstration of what's happening across the nation. Can you talk about what that funding in the CR, what the level you would need to fund our VA hospital staffing levels appropriately, as well as other VAs across the nation for our veterans to receive the care they deserve?
Thank you, Congressman. Happy to do that. And I just wanted to let you know that my personal attention is on making sure that things improve and improve fast at the Buffalo VA. It's what the veterans in your district and around the Buffalo area deserve. I'll first say that the part of the supplemental will support our ability to increase our overall staffing level by about 5,000 employees over and above where we were in mid-June. Now, we've attrited a little bit since then, so that number may change by the end of the fiscal year. But the point is, we would be able to grow responsibly and within the budget to be able to meet growing veteran care needs. And that's exactly what we're seeing in Buffalo and in medical centers across the country. So the inclusion as an anomaly in CR is an extremely important tool for us to be able to do that and maintain within the budget.
The number that's been discussed is $12 billion. Is that accurate from your estimation?
Yes, Congressman, that's the request in the supplemental.
Thank you. So the fact that that's not included in this continuing resolution is a real problem, not just for Buffalo staffing, but for staffing across the nation. But you know, Buffalo being right in the heart of the district that I represent and having these issues, I think it's outrageous that it's not included. Let's talk about moving forward in infrastructure. The hospital in Buffalo, I know it's not alone, but it was built in the 1940s. It opened up in 1950. It's going on 75 years now. Doesn't have proper HVAC system. You know, the building itself is falling apart in many ways while we're putting Band-Aids on it. You know, thank God for the staff that is working there, that's taking care of our veterans, but they need resources there. We ultimately need a new hospital, a new VA hospital in Buffalo. And we're not alone. We're talking about putting hundreds of millions of dollars into the current VA hospital. We need a new VA hospital that's technologically advanced, that gives our frontline heroes, the nurses, the healthcare practitioners, the resources they need to take care of our veterans. Can you comment on that, what it'll take to get that done, and do we have your commitment to making that happen?
Listen, I agree, Congressman. We've requested in multiple budgets substantially more major and minor construction funding. I look forward to visiting the Buffalo VA with you in the coming weeks to witness myself what the condition of the infrastructure is. But the fact that the average medical center's age of plant is over 60 years, I haven't seen any other health system with infrastructure that old. And so we need to invest in it. I've already contacted our construction and facilities management team, and our team that works on infrastructure will work with you to get it on the priority list to make sure that we address it. It's going to take some time, but my commitment to you is that we'll start that process.
Thank you.